So hello everyone, good afternoon. I hope you all are keeping safe at your places. And we all know that COVID is not over yet, and we need to be very careful about COVID, and we should not be careless about it. So we need to take good care of ourselves for preventing ourselves from COVID. So for today, we have a very interesting topic of sudden cardiac arrest with none other than our favorite Dr. Aparna Jaswal, who is Director Cardiologist and Electrophysiologist at Fortis Escorts Heart Institute, Okhla. So with this, I would like to invite Dr. Aparna Jaswal for the session of the day.
Hello to all of you, and thank you so much, Jaya, for setting the stage. At the very outset, the reason we chose sudden cardiac arrest as a topic of discussion for today was because those of us who are engaged in watching sports do realize what happened in Euro 2021 with the captain of the Denmark team, Christian Eriksen, and that was scary, those of us who are watching it live. And it is not something which is unusual, and we all talk about it, we all fear it, but it's a good point that we understand that can I, as an individual, understand what happens in sudden cardiac arrest and can I prevent it? So the format for today that we have kept is that Miss Jaya is going to help us with questions that have been posted to her from the viewers, and she's going to throw those questions at me, and I will try and justify and answer them in the next couple of minutes so all of us can understand. Should you all have any more questions, please feel free to push your questions in. We will try and accommodate to our best, and let's see how it goes on. So hang on there with us and let's take it forward. Yes, Jaya.
Right. So ma'am, on the very onset, I would like to know what actually the sudden cardiac arrest is.
So if I were to answer what is sudden cardiac arrest, as the name implies, it is a sudden stopping of all biological functions, and what happens is it stops the heart from beating, along with the patient stops breathing and loses consciousness. Now all of this happens so suddenly that it could happen in any sequence, that is, the patient could be anywhere out of his home. Obviously, if the patient knew that something like this is going to happen, he would either be in a doctor's clinic or he would be in a hospital. So it is not that it does not happen inside the hospitals. We see sudden cardiac arrests happening even inside the hospitals. But sudden cardiac arrest is sudden stopping of the heart function, breathing and consciousness. That is what encompasses sudden cardiac arrest. And remember, it happens suddenly. It is a bolt out of the blue. It comes unexpectedly. That's why it is a lethal thing to happen.
Right, ma'am. And ma'am, what do you think, what can lead to sudden cardiac arrest?
Yeah, so what leads to sudden cardiac arrest? As the name implies, there is something which is happening suddenly. There is a sudden change in the electrical function of the heart. As we all know, the heart pumps 60 to 100 times a minute, and we can feel that by our pulse rate. So what is sudden cardiac arrest? In sudden cardiac arrest, the heart begins to beat abnormally fast, and that is called ventricular fibrillation. While in the normal sinus rhythm, it was to beat 60 to 100 times a minute, when the patient has sudden cardiac arrest, the heart beats as much as 250 or more. As a result, the heart is unable to make any effective contraction. Because there is ineffectual contraction, there is no circulation of blood to the heart, to the brain, to the vital organs of the body, and the individual collapses. So what happens in sudden cardiac arrest is very fast, abnormal beating of the heart, which results in ventricular fibrillation and inadequate blood supply to the entire body.
Right, ma'am. So ma'am, what do you think, like what can be the risk factors of sudden cardiac arrest? Like can lifestyle be a reason for this?
So I think that's a very pertinent question that she brings up, that why do people have sudden cardiac arrest? It is known that it is a very common occurrence, and we must discuss and talk about it, learn about it, because we can prevent it. It is as common as 1 per 1,000 per year in the world have sudden cardiac arrest. So that's a very common occurrence. So what is it that causes it? In most of the cases, and as much as 80 to 90% of the cases, the cause of sudden cardiac arrest is a disease of the blood vessels of the heart, what we call coronary artery disease or ischemic heart disease. So remember, those of us who have diabetes, have hypertension, are smoking, have a strong family history, lead sedentary lifestyle, consume large amounts of salt and alcohol and fat, push ourselves to be at risk of sudden cardiac arrest, because in those patients, the milieu is perfect to develop a disease in the blood vessels of the heart that is called coronary artery disease. So those of us who have risk factors, if we work on our risk factors, we minimize the risk of sudden cardiac arrest. So those are the risk factors that you should remember. If we want to minimize our risk of sudden cardiac arrest, we must act upon the risk factors that we all as adults carry within our bodies. They being high blood pressure, high blood sugar, smoking, excess alcohol, sedentary lifestyle, and poor food habits. Work on each of these elements in your lifetime. You can minimize your risk of sudden cardiac arrest.
Right, madam. Thank you for the information. The next question we have for you is, like, how can someone recognize that he had a sudden cardiac arrest?
So the question is, how can someone recognize that he has had a sudden cardiac arrest? So I think before we reach there, we have to understand how can one recognize that he is at a risk of sudden cardiac arrest. So those of us who are adults, that means not 18 but yes, in the group of beyond 35 years, and those of us who have risk factors for heart disease such as hypertension, diabetes, smoking, we know we have disease in the blood vessels of the heart. This is the group who has a risk of sudden cardiac arrest. So we must work aggressively in controlling our risk factors. Coming back to the question that she posed to me, that how can I recognize that I've had sudden cardiac arrest? Well, if we have lifestyle disorders, and if you ever feel that you are going to faint, or you have fainted and you have revived yourself, it's a good idea to meet your doctor. Let your doctor decide. Let your doctor put you through certain tests, and they will tell us that are you at risk of having a heart disease, or if you have heart disease, are you at risk of sudden cardiac arrest? So the take-home message for this question would be, it's pertinent that you address your lifestyle diseases, connect with your doctor, and get the tests done as your doctor advises.
Right, ma'am. Thank you. Now, another question we have for you is, can someone recover from sudden cardiac arrest? Like, it seems horrifying. Would like to know the probability of survival from sudden cardiac arrest.
Yes. So, at the very outset, you must distinguish that there is sudden cardiac arrest and sudden cardiac death. So when we say that somebody had sudden cardiac arrest, we imply that the individual has actually survived it. If somebody does not survive it and dies, it is called sudden cardiac death. To give you a very simple example and to put it in perspective, those of us who watched Christian Eriksen during the match of Denmark, he fell down on the ground, and that is what is called sudden cardiac arrest. He lay unconscious, and suddenly all the medical help came in and revived him with a shock. He was given a defibrillator shock from AED, an automated external defibrillator, and he was revived. So that is called sudden cardiac arrest. But not many have been so fortunate. For example, one name which hits my mind immediately is Mr. Abdul Kalam. All of us are aware that he was on a dais and addressing a group of students, and he fainted. He had sudden cardiac arrest on the dais. However, he was not as lucky and he could not be revived, and that sudden cardiac arrest, because it was not intervened and he could not be revived, it landed up in sudden cardiac death. Meaning thereby that when a patient falls unconscious, and if it is one of your relative and you know that he's a high risk candidate, means he has diabetes, hypertension, he's a smoker, he already has certain amount of cardiac illness, it's a good idea that we all understand that the patient could be at risk of sudden cardiac arrest, and we do the needfuls. Also, I think our society has come to a point that all of us together must engage in learning basic life support. If we know the basic life support, if we know what CPR is, we will be able to save several lives by attending to the patient and giving basic life support.
Yes, ma'am. Ma'am, we had a great loss of Dr. APJ Abdul Kalam from sudden cardiac arrest. So, what do you suggest? Like, what could be the main assessment indicator for sudden cardiac arrest? Like, someone gets to know that he had sudden cardiac arrest. What would be the next step for this?
Right. So, in the community, I think it is unfortunate that India is a capital of diabetes, and also we have very high penetration of hypertension. As much as 1 out of 4 adults has hypertension, and of course diabetes, our country is the diabetic capital. So to keep it very simple, those adults who have diabetes and hypertension must work aggressively on risk factor lowering so that they do not develop heart disease. If they have developed heart disease and their heart pumping is normal, it's important they address their heart disease with their cardiologists, even if it means just medical management. Some of them may need stents, some of them may need bypass surgery. All of those should be done, and subsequently should be on good medications to minimize your risk of sudden cardiac arrest. We must remember, in a subset of patients who have these problems, their heart pumping, which is seen on an echocardiogram, may come down, where what you call is ejection fraction. If the patient's ejection fraction is compromised, that is EF, which is noted on an echocardiogram, if the ejection fraction is compromised and is less than 30 to 35%, it is important that the patients understand they may need a device which is called a defibrillator. So a defibrillator is a simple device, and these defibrillators come in these types. These defibrillators are implanted below your collarbone on the left side in majority of the cases. So this defibrillator is called an ICD. It's implantable cardioverter defibrillator. It is of utility to those patients whose ejection fraction is lesser than 30 to 35%, irrespective of the cause. It's important to discuss with your cardiologist that if you need one, if your cardiologist thinks, you must consider having an ICD implanted, because this device is indeed a medical marvel. For those patients who are at risk of sudden cardiac death, this ICD minimizes your risk of sudden cardiac arrest. It's a device which is implanted under the skin, and it is as if you have a very intelligent doctor sitting inside your chest wall. This defibrillator watches every beating of the heart. When it sees that your heart is behaving abnormally, that means I told you already that it should beat 60 to 100 times a minute, and if your heart begins to beat abnormally fast, the ICD is trained to deliver therapy such that your heartbeat comes back to normal, meaning thereby that you could be saved from the sudden cardiac arrest episode by the intervention of the defibrillator. The defibrillator may sometimes give shocks, which you should understand and discuss with your cardiologist before you go in for an implantation, so you know what you're in for when you have the device implanted.
Right, ma'am. So ICD seems to be very useful for the patient who have a sudden cardiac arrest. So ma'am, very basic questions from the list of your patients. That what basically the hospital do when they, in the case of sudden cardiac arrest, when someone goes with sudden cardiac arrest.
Yeah. So what I understand is, if the patient comes into the emergency room with sudden cardiac arrest, what do we do? So the most important point here is that we have to work very aggressively. We have to be really quick in addressing the problem, because the chances of survival minimize by the minute as the patient has sudden cardiac arrest. So as soon as the patient comes into the emergency room, and if we see that the patient is having very fast beating of the heart, we immediately put the patient on a defibrillator, which is a large device which you would have seen in hospitals, in clinics, and some of you may have seen in movies. We attach the patient to a defibrillator and we give an external therapy with the help of paddles. We revive the patient immediately. Sometimes we may have to give artificial ventilation wherein a tube is put inside the mouth, and we revive the patient and the patient comes back to normal life. But the most important message here is that we have to work really quick to salvage the patient, because every minute the chances of patient surviving come down by 10%. So that's why we have to act really quickly to save the patient.
Right, ma'am. Ma'am, another very common question is like, what is the difference between sudden cardiac arrest and a heart attack?
Yeah, I think that's a very important point to address. What is the difference between sudden cardiac arrest and heart attack? So what is a heart attack? A heart attack is when a patient complains of sudden tearing pain in the center of his chest, as if somebody has tied a band, or somebody is sitting on his chest, and the pain from here can radiate to the top of his shoulders, can also go along the inner side of the arm. This is called a heart attack. A heart attack is because of sudden occlusion or blockage of the blood vessel of the heart. That is a heart attack. While sudden cardiac arrest, as I told you in the very beginning, is an electrical problem of the heart. The heart begins to beat abnormally fast. It is supposed to normally beat between 60 to 100 times a minute, but when there is a sudden cardiac arrest, it can beat as much as 250 to 300 times a minute, meaning there is ineffectual contraction. That is the distinction between a heart attack and a sudden cardiac arrest. Unfortunately, there always remains a confusion and the public is unable to understand the distinction between the two. We must be very clear. Heart attack means blockage of the blood vessels of the heart, but during a heart attack, a patient is susceptible to sudden cardiac arrest. Hence, you must immediately rush to a hospital when you suspect that you may have a heart attack. While in a sudden cardiac arrest, it can come out of the blue, it can present itself without chest discomfort. Sudden cardiac arrest can present itself for the very first time with the patient falling down on the ground. Hence, those of us in the community who are at a high risk of lifestyle diseases, of developing heart disease, must address our lifestyle diseases aggressively. Keep your blood pressure under control. Keep your diabetes under control. Remember to exercise regularly. Do not smoke. Look after your lifestyle in terms of go for regular exercises. Look after your diet. If you work on all these elements aggressively, you minimize your risk of sudden cardiac arrest.
Right, ma'am. Ma'am, from the viewers, we have one question from Zubair Ahmed, who is asking, like, those people who already have an ICD with them, can they also be involved with sudden cardiac arrest?
Yes. So, what does an ICD do? An ICD is an implantable cardioverter defibrillator. An ICD is implanted under the skin, under the collarbone. What does this ICD do? This ICD watches every beating of the heart. As soon as it sees that there is abnormal beating, means that the patient is actually having a sudden cardiac arrest, before the patient faints or falls, this ICD delivers therapy. The ICD can deliver therapy either by quickly giving shock impulses to the heart and break that rhythm, but sometimes it may have to give a shock, just like you see that the patients get an external shock. This ICD is a very small device, but it is a medical marvel. It has the capacity to deliver a shock therapy to the heart and revive the heart. So it gives a shock internally when it thinks that the heart needs a shock, and brings back the heart to a normal beating of 60 to 100 times a minute.
Right, ma'am. So, ma'am, another question from our viewer is, can sudden cardiac death happen to anyone?
So we must remember that sudden cardiac death is common. I already said that it comes 1 per 1,000 globally in a year. So it's a common occurrence. Whom does it affect? It typically affects younger adults. Young means those who are beyond 35 years of age. It typically affects those who have disease in the blood vessels of the heart, but they may not know for sure that they have disease in the blood vessels of the heart. It typically affects those who have lifestyle diseases, means if you have the risk factors for heart disease, or you already have heart disease and have poor pumping of the heart, you have a higher chance of sudden cardiac arrest. To put it very simple, the risk is largest for those patients who already have heart disease and have poor pumping of the heart. They are at highest risk. Have those who have heart disease and the ejection fraction is lesser than 30 to 35%. The next subgroup is those people who already have heart disease with lifestyle diseases. The third group is that who have lifestyle diseases but do not know that they have heart disease. Must remember that those of us who have no lifestyle diseases also are at a minimal risk of having sudden cardiac arrest. Means we all must tend to our heart. We must look after it. We must look after our diet. We must exercise every day. We must eat healthy. We must not smoke. So these are very simple pointers which can protect us from sudden cardiac arrest and death.
Right, ma'am. So, ma'am, we have many questions in our comment section, and I think we have covered all of them. So, do you have any take-home message for your viewers?
Yes, my take-home message is we must understand first that sudden cardiac arrest is common. We must understand that sudden cardiac arrest will not just happen to our neighbors. Sudden cardiac arrest can affect any of us or our family members. It is our duty to learn basic life support and cardiopulmonary resuscitation so that if any of our loved ones suffers a sudden cardiac arrest, we can come to their rescue. We must recognize that there are certain risk factors which put us at risk of sudden cardiac arrest. The risk factors are if you have diabetes, if you have high blood pressure, if you are smoking, you are sedentary, consume large amounts of alcohol, or have a high family history of developing heart disease. It is not difficult to act on these risk factors and minimize your risk of sudden cardiac arrest. Those of us who have family members who have already suffered from a heart disease and have a poor pumping of the heart, ejection fraction less than 30 to 35%, it is a good idea that you address this to your doctor by asking them if your patient needs the implantable cardioverter defibrillator. Thank you so much for being with us, and we will see you shortly with some other topic on another day. Thank you so much. Goodbye.